Welcome back on this Wellness Wednesday. With the start of a new year, many people want to hit reset on their diets, but in many cases, it may not be the healthiest approach. In fact, it can certainly be dangerous in many cases. Eating disorders like anorexia, bulimia, or even binge eating are more common than people might think. According to the National Eating Disorder Association, nearly 29 people experience an eating disorder sometime in their life. So joining me now live in studio is therapist Dr. Morgan Francis of Scottsdale Premier Counseling. Thanks for being here this afternoon.
Thank you for having me.
Absolutely. So let's start with step one. How do you know if someone is struggling? Is it physically obvious to a friend or family member?
Actually, no, it may not always be physically obvious. So it's important to recognize that eating disorders do not have a look. We can never tell how healthy or unhealthy someone is just by looking at them. And that's what makes it really difficult to know if someone is struggling. So typically what we see with an eating disorder is someone who is preoccupied with weight loss or health in the way that it's intentional and it's disruptive in their life.
And it's their only focus, maybe their only priority, and they're kind of obsessed with it. I feel like I've had friends in the past who've just become obsessed with journaling, and that can be helpful, but not to that obsessed point maybe.
Correct. So it becomes disruptive in their personal relationships, maybe their work. If they're a student, it disrupts their ability to study or attend class. They're really missing out on social activities. So we will see isolation and withdrawal because they're feeling too insecure or self-conscious or consumed with being afraid to go out to a gathering because they don't want to eat anything outside of what they maybe journaled or the diet that they are on.
Okay, yes, doc. And then how do you talk to that friend or loved one if you might show some interest in maybe some suspicion there?
Yeah, it's really important to know that they may not be ready to talk. So a great way to come to someone who you may have concerns with is to use I statements. I care about you. I'm concerned. I've noticed some changes within the way that you are acting in your life, rather than going to them saying, you look way too thin. So we want to stay away from saying anything that would be commenting about their appearance, and coming from a place of compassion and empathy and knowing that this is a really sensitive topic. So it's okay to suggest, would you like me to go with you or help you find a therapist to work with to talk about this?
And that was the next thing on this list of this particular discussion is if they need professional help, what does that look like? And saying those I statements, and I would be willing to go with you, how do you approach that?
It can be really overwhelming for someone to start therapy when they've never started before and to talk about something that they've kept a secret for a long time in their life. So being able to say, hey, let me help you try to find a therapist and do the research or go with them to their first appointment, offering them that care and support and knowing that they're not alone can be the most important thing that we can do for someone who's struggling with an eating disorder.
And I know you've shared plenty of resources with us specifically about who's available out there. I think that can be the most daunting thing is if you're trying to Google search somebody to help you, how would you recommend doing that? Is finding that person to talk to and confide in about something so personal physically?
So the greatest way that we know that there's going to be a positive is when a person feels safe talking to the therapist or the medical doctor that they are meeting with. There needs to be rapport. And so you can talk to that person on the phone for a couple of minutes. You can ask them questions. It's really about what you, the person that's struggling, really needs and feeling safe. So I would say making sure that you are in a place where you are comfortable is the #1 thing that is going to be the most helpful in the experience of reaching out for help.
And not being afraid to certainly take that step forward, especially in the new year. Of course, we all want to look and feel our best, but not do anything that's counterintuitive.
Exactly.
Yes, Dr. Francis, thank you so much. We appreciate your time this afternoon.
Thank you for having me.
Of course.